Hi John, we're here for your mini gastric bypass post-surgery visit. Do you give Dr. Rutledge and CLOS permission to use your video on the internet?
Absolutely.
Okay, John, why don't you tell us a little bit about your surgery and your post-op medications for your back pain?
Pre-surgery, I was 280 pounds. I came in, worked almost a year and a half doing research to determine if this is surgery that I really wanted to do, and very apprehensive. I've been on 10 plus medications for a long time. One of the medications I've been on since 1979 was for back pain. I was in a bad accident, and it's pretty much debilitating back pain, and so every morning I have to take my regimen of back pain. After the surgery, I haven't had to take one pain medication for my back at all. I haven't had any problem at all with that. I used to take Perlosec, which I always called, and I even told Dr. Rutledge, that was the miracle pill that they invented. And I'd been taking that probably since the early 80s. I'm kind of hazy on that time. But after surgery, I haven't had to take any of that at all. From being on over 10 medications on standard a day, I'm down to 3 medications right now. I'm 2 weeks out. I've lost 21 pounds, 12 ounces in 2 weeks. And I feel a whole lot improved. And I can actually sit and play with my children now. And I feel a whole lot more energetic than I had been. There was a downside to my surgery. And I think everyone should know that it's not, you're in today and you're out tomorrow. There are times when things happen, and unfortunately I was one of those patients. There was a complication during my surgery that Dr. Rutledge or anyone else probably couldn't have really predicted. I had had a surgery 37 years ago that left some scar tissue inside me, and it became a little bit of a complication during the surgery. Dr. Rutledge had to do a second minor surgery on me, and I had to stay in the hospital for an extra period of time, which wasn't a big deal. The major downside of that was I had a tube down my nose, down my throat, an NG tube. Extremely uncomfortable, extremely uncomfortable. That was the major downside of that second part of the surgery. But I have to say this, Dr. Rutledge was in at least once a day, if not twice a day. The staff was in. I had his private phone number. I couldn't ask for anything more. I've never, in all my entire life, and all the doctors that I've seen, had a doctor that I thought was that caring and really, really was concerned about me and my condition. So thumbs up to those guys. And I recommend the surgery. Like I say, I had a small complication. Folks, it's going to happen, and I just happen to be the unlucky one. But I'm well aware of it, and tomorrow morning I would do it again. I wouldn't think twice about it.
Oh, thank you, John. I have one more question.
Sure.
How did you hear about the mini gastric bypass?
Well, actually, my wife is a director here at St. Rose Hospital, and she suggested for me to look into the surgery. She didn't suggest that I do the surgery. She suggested I look into the surgery along with other surgeries. And so I want to make that clear that I looked into multiple diet plans. They all worked for the first day. And after that, not so much. I looked into the RNY and the gastric band, and just, getting on the community, on the website, talking with literally hundreds of former patients, and settling in and feeling extremely comfortable. That was the secret for me, feeling comfortable. The other surgeries and other ideas and stuff just didn't seem to have that comfort zone for me. It didn't have all the answers that I found here. And I'm comfortable with it. I'm extremely comfortable.
Well, John, thank you very much, and good luck, and we'll talk to you in a month.
Thank you all.
Have a good day.